Welcome to NSG 222, Study Session 10, Health Assessment in Nursing. Introduction. Assessment is the collection of data about an individual health state. Assessment and examination are terms which are sometimes used interchangeably. Both refer to a critical investigation and evaluation of client status. In this study session, we will study the technique of collecting and analyzing subjective data, that is, what the person says about himself or herself during history taking, and objective data, that is, what you as the health professional observe by inspecting, perusing, palpating, and auscultating during physical examination. Learning outcome. At the end of this study session, you should be able to 1. Discuss the importance of health assessment in nursing. 2. Carry out a general survey of a patient. 3. Conduct a physical examination of an adult head to toe. Health assessment. Assessment is the collection of data about the individual's health state together with the patient's record and laboratory studies. These elements form the database. From the database, you make a clinical judgment or diagnosis about the individual's health state or response to actual or risk health problems and life processes, as well as diagnosis about higher level of wellness. The purpose of assessment is to make a judgment or diagnosis. The reasons or purpose for carrying out health assessment. Nurses use physical assessment to develop, obtain baseline data, and expand the database from which subsequent phases of the nursing process can evolve. To identify and manage a variety of patient problems, actual and potential. Evaluate the effectiveness of nursing care. Enhance the nurse-patient relationship. Make clinical judgments. General survey. In general survey, you observe the patient's general state of health, height, build, and sexual development. Obtain patient's weight. Also, you note the posture, motor activity and gait, dress, grooming, and personal hygiene, and any odors of the body or breath. Watch the patient's facial expressions and note manner, affect, and reactions to persons and things in the environment. Listen to the patient's manner of speaking and note the state of awareness or level of consciousness. The complete health history. The purpose of health history is to collect subjective data, what the person says about himself or herself. The history is combined with the objective data from the physical examination and laboratory studies to form database. The database is used to make a judgment or a diagnosis about the health status of the individual. It describes the individual as a whole and how the person interacts with the environment. It records health strength and coping skills. The history should recognize and affirm what the person is doing right and what he or she is doing to stay well. For the well person, the history is used to assess his or her lifestyle, including such factors as exercise, diet, and risk reduction, and health promotion behaviors. For the healed person, the health history includes a detailed and chronological record of the health problems, For all, the health history is a screening tool for abnormal symptoms, health problems, and concerns, and it records way of responding to the health problems. In many settings, the patients fill out a printed history form or checklist. This allows the person ample time to recall and consider such items as dates of health, landmarks, and relevant family history. In many settings, the patients fill out a printed history form or checklist. This allows the person ample time to recall. The interview is then used to validate the written data and to collect more data on lifestyle management and current health problems. Although history forms vary, most contain information in this sequence of categories. The health history. The adult. The health history of an adult includes the following: biographic data, reason for seeking care, present health or history of present illness, past health, family history, review of system, functional assessment, including activities of daily living. 1. Biographic data. Name, address, and phone number, age and birth date, birthplace, gender, marital status, race, ethnic origin, occupation, usual and present, and illness or disability may have prompted change in occupation. 2. Reason for seeking care. This is a spontaneous statement in the person's own words that describes the reason for the visit. Think of it as the title for the story to follow. It states one or two symptoms and signs and their duration. A symptom is a subjective sensation that the person feels from the disorder. A sign is an objective abnormality that you, as the examiner, would detect on the physical examination or in laboratory reports. Whatever the person says is the reason for seeking care, as recorded, enclosed in quotation marks to indicate the person's exact words. The reason for seeking care is not a diagnostic statement. Avoid translating it into the terms of a medical diagnosis. Occasionally, a person may list many reasons for seeking care. The most important reason to the person may not necessarily be the one stated first. Try to focus on which is the most pressing concern by asking the person which one prompted him or her to seek help now. 3. Present health or history of present illness. For the well person, this is a short statement about the general state of health. For the healed person, this is a chronologic record of the reason for seeking care from the time the symptom first started until now. Take 2. For the healed person, this is a chronologic record of the reason for seeking care from the time the symptom first started until now. Isolate each reason for care identified by the person and say, "Please tell me all about your headache, from the time it started until the time you came to the hospital." If the concern started months or years ago, record what occurred during that time and find out why the person is seeking care now. As the person talks, do not jump to conclusions and bias the story by having your opinion. Collect all the data first. Your final summary of any symptom the person has should include these 8 critical characteristics. Location. Be specific. Ask the person to point to the location. If the problem is pain, note the precise site. Head pain is vague, whereas Descriptions such as pain behind the eyes, jaw pain, and occipital pain are more precise and are diagnostically significant. Is the pain localized to this site or radiating? Is the pain superficial or deep? Character of quality. This calls for specific descriptive terms such as burning, sharp, dull, aching, gnawing, throbbing, shooting, and vice-like. Use similes. Does blood in the stool look like sticky tar? Does blood in vomitus look like coffee grounds? Quantity or severity. Attempt to quantify the signs and symptoms such as profuse menstrual flow, soaking 5 parts per hour. The symptom of pain is difficult to quantify because of individual interpretation. What one may identify as terrible pain, another may describe as not too bad. With pain, avoid adjectives and ask how it affects daily activities. Then, the person might say, I was so sick, I was doubled up and couldn't move. Or, I was able to go to work, but then I came home and went to bed. Timing, onset, duration, frequency. When did the symptom first appear? Give the specific date and time, or state specifically how long ago the symptom started prior to arrival. The pain started yesterday will not mean much when you return to read the record in the future. The report must include questions such as how long did the symptoms last? Duration. Was it steady, constant, or did it come and go during that time? Intermittent. Did it resolve completely and reappear days or weeks later? Cycle of remission and excavation. Setting. Where was the person or what was the person doing when the symptoms started? What brings it on? Aggravating of relieving factors. What makes the pain worse? Is it aggravated by weather, activity, food, medication, standing bent over, fatigue, time of day, season, and so on? Past health. Past health events may have residual effects on the current health state. Also, the previous experience with illness may give clues as to how the person responds to illness and to the significance of illness for him or her. Okay? Childhood illnesses. Measles, mumps, rubella, chickenpox, pertussis, and strep throat. Avoid recording usual childhood illnesses because an illness common in person's childhood may be unusual today. Ask about serious illnesses that may have spoiled for the person in later years, e.g., rheumatic fever, scarlet fever, and poliomyelitis. B. Accident of injuries. Auto accidents, fractures, penetrating wounds, head injuries, especially if associated with unconsciousness, and burns. C. Serious or chronic illnesses, diabetes, hypertension, heart disease, sickle cell anemia, cancer, and seizure disorder. D. Hospitalization. Cause, name of hospital, how the condition was treated, how long the person was hospitalized, and name of the physician. E. Operations. Type of surgery, date, name of the surgeon, name of the hospital, and how the person recovered. F. Obstetric history. Number of pregnancies, gravidity, number of deliveries in which the fetus reached full term, number of preterm pregnancies, number of incomplete pregnancies, abortions, and number of children living. This is recorded as A. Graph term, preterm, AB living. B. For each complete pregnancy, note the cause of pregnancy, labor and delivery, sex, weight, and condition of each infant, and postpartum cause. For any incomplete pregnancies, record the duration and whether the pregnancy resulted in spontaneous S or induced high abortion. G. Immunizations: measles, mumps, rubella, polio, diphtheria, pertussis, tetanus, hepatitis B, human papilloma virus, Haemophilus influenza type B, pneumococcal vaccine. Note the date of the last tetanus immunization, last tuberculosis skin test, and the last flu shot. H. Last examination date. Physical, dental, vision, hearing, electrocardiogram, chest x-ray examinations. Height, allergies. Note both the allergen, medication, food of contact agents such as fabric or environmental agent, and the reaction, rash, itching, running nose, watery eyes, difficulty breathing. With a drug, this symptom should not be a side effect but a true allergic reaction. Current medications. Not all prescription and over-the-counter medications. Ask specifically about vitamins, birth control pills, aspirin, and antacids, because many people do not consider these to be medications. For each medication, note the name, dose, and schedule, and ask, how often do you take it each day? What is it for, and how have you been taking it? Finally, note any herbal remedies. 5. Family history. Ask about the age and health or the age and cause of death of blood relatives, such as parents, grandparents, and siblings. This data may have genetic significance for the patient. Also, ask about close family members, such as spouse and children. You need to know about the person's contacts with any communicable diseases or the effects of a family member's illnesses on this person. Specifically, ask for any family history of heart disease, high blood pressure, stroke, diabetes, blood disorders, cancer, sickle cell anemia, arthritis, allergies, obesity, alcoholism, mental illness, seizure, disorder, kidney disease, and tuberculosis. Construct an accurate family tree or genogram to show this information clearly and closely. 6. Review of system. General overall health system, present weight, gain or loss, period of time, by diet or other factors, fatigue, weakness or malaise, fever, chills, sweat or night sweats. Skin, history of skin disease, eczema, psoriasis. Eyes, pigment or color change, change in mole, excessive dryness or moisture, pruritus, excessive bruising, rash or lesion. Hair, recent loss, change in texture. Nails, change in shape, color or brightness. Health promotion, amount of sun exposure, method of self-care for skin and hair. Head, any unusually frequent or severe headache, any head injury, dizziness, syncope or vertigo. Eyes, difficulty with vision, decreased acuity, blurring, blind spots, eye pain, diplopia, double vision, redness or swelling, watering or discharge, glaucoma or cataracts. Health promotion, wears glasses or contacts, last vision check or glaucoma test, and how coping with loss of vision if any. Ears, ear aches, infections, discharge and its characteristics, tinnitus or vertigo. Health promotion, hearing loss, hearing aid use, how loss affects the daily life, any exposure to environmental noise and method of cleaning ears, nose and sinuses, discharge and its characteristics, any unusually frequent or severe cold, sinus pain, nasal obstruction, nosebleeds, allergies or hay fever, or change in sense of smell. Mouth and throat. Mouth pain, frequent sore throat, bleeding gums, toothache, lesion in mouth or tongue, dysphagia, hoarseness or voice change, tonsillectomy, altered taste. Health promotion, pattern of daily dental care, use of prosthesis dentures, bridge and last dental checkup. Neck, pain, limitation of motion, lumps or swelling, enlarged or tender nodes, goiter. Breast, pain, lump, nipple discharge, rash, history of breast disease, any surgery on the breast. Health promotion, performs breast self-examination, including its frequency and method used, last mammogram. Axilla, tenderness, lump or swelling, rash. peripheral vascular, coldness, numbness and tingling, swelling of legs, time of day, activity, discoloration in hands or feet, bluish red, pallor, mottling, associated with position, especially around feet and ankles, varicose veins or complications, intermittent claudication, thrombophlebitis, ulcers. Health promotion. Does the work involve long-term sitting or standing? Avoid crossing legs at the knees. Wear support poles. Gastrointestinal. Appetite. Food intolerance. Dysphagia. Heartburn. Indigestion. Pain associated with eating. Other abdominal pain, pyrosis, esophageal and stomach burning sensation with sore eructation, nausea, vomiting, character, vomiting blood, history of abdominal disease, ulcer, liver or gall bladder, jaundice, appendicitis, colitis, flatulence, frequency of bowel movement. Any recent change, stool characteristics, constipation or diarrhea, black stools, rectal bleeding, rectal conditions, hemorrhoids, fistula. Health promotion, use of antacids or laxatives. Urinary system, frequency, urgency, nocturia, the number of times the person awakens at night to urinate, recent change, dysuria, polyuria or oliguria, persistency or straining, narrowed strain, urine color, cloudy or presence of hematuria, incontinence, take 2, incontinence, history of urinary disease, kidney disease, kidney stones, urinary tract infections, prostate, pain in the flank, groin, suprapubic region or low back. Health promotion, measures to avoid or treat urinary tract infections. Use of Kegel exercises after childbirth. Male genital system, penis or testicular pain, sores or lesions, penile discharge, lumps, hernia. Health promotion, perform testicular self-examination. How frequently? Female genital system, menstrual history, age at menarche, last menstrual period, cycle and duration, any amenorrhea or menorrhagia, premenstrual pain or dysmenorrhea, intermenstrual spotting, vaginal itching, discharge and its characteristics, age at menopause, menopausal signs or symptoms, postmenopausal bleeding. Health promotion, last gynecologic checkup and last Papa-Nicolau test. Sexual health, presently in a relationship involving intercourse. Are the aspects of sex satisfactory to the patient and partner? Any dyspareunia for female, any changes in erection or ejaculation for male, and use of contraceptive. Is the contraceptive method satisfactory? Aware of contact with a partner who has any sexual transmitted disease, gonorrhea, herpes, chlamydia, venereal warts, HIV and AIDS or syphilis. Musculoskeletal system. History of arthritis or growth in the joint. Pain, stiffness, swelling. Location, migratory nature. Deformity, limitation of motion. Noise with joint motion. In the muscles, any pain, cramps, weakness, gait problems, or problems with coordinated activities. In the back, pain location and radiation of extremities, stiffness, limitation of motion, or history of back pain or disc disease. Health promotion. How much walking per day? What is the effect of limited range of motion on daily activities, such as on grooming, feeding, toileting, and dressing? Are any mobility aids used? Neurologic system. History of seizure disorder, stroke, fainting, blackout, in motor function, weakness, tic or tremor, paralysis or coordination problems. In sensory function, numbness and tingling, paresthesia. In cognitive function, memory disorder, recent or distant disorientation. In mental status, any nervousness, mood change, depression, or any history of mental health dysfunction or hallucinations. Health promotion. Alternatively, data about interpersonal relationships, coping patterns placed here. Hematologic system. Bleeding tendency of skin or mucous membranes, excessive bruising, lymph node swelling, exposure to toxic agents or radiation, blood transfusion and reactions. Endocrine system. History of diabetes or diabetic symptoms, polyuria, polydipsia, polyphagia. History of thyroid disease, intolerance to heat and cold, change in skin pigmentation or texture, excessive sweating, relationship between appetite and weight, abnormal hair distribution, nervousness, tremors, and need for hormone therapy. Functional assessment, including activities of daily living. Functional assessment measures a person's self-care ability in the areas of general physical health or absence of illness. ADLs such as bathing, dressing, toileting, eating, walking, instrumental activities of daily living. High ADLs or those needed for independent living, such as housekeeping, shopping, cooking, doing laundry, using the telephone, managing finances, nutrition, social relationships and resources, self-concept and coping, and home environment. Functional assessment may mean organizing the entire assessment around functional pattern areas. Gordon, 2002. Instruments that emphasize functional categories may help in leading to a nursing diagnosis. Functional assessment may also mean that the health history may be supplemented by a standardized instrument on functional assessment. These instruments objectively measure a person's present functional status and monitor any changes over time. These questions provide data on the lifestyle and type of living environment to which the person is accustomed. Since some of the data may be adjudged private by the individual, The questions are best asked at a later point in the interview after you have had time to establish rapport. Self-esteem, self-concept, education, last grade completed, other significant training, financial status, income adequate for lifestyle and or health concerns, value belief system, religious practices, and perception of personal strengths. Activity, exercise. A daily profile reflecting usual daily activities. Ask, tell me how you spend a typical day, not ability to perform ADLS. Independent or need assistance with feeding, bathing, hygiene, dressing, toileting, bed to chair transfer, walking, standing, or climbing stairs. Any use of wheelchair, prosthesis, or mobility aids. Record leisure activities enjoyed and the exercise pattern. Type amount per day or week. Method of warm-up session. Method of monitoring the body's response exercise. Sleep or rest. Sleep patterns. Daytime naps. Any aids used. Nutrition. Elimination. Record the diet by a recall of all food and beverages taken over the last 24 hours. Is the menu typical of most days? Describe eating habits and current appetite. Ask, who buys food and prepares food? Are your finances adequate for food? Who is present at meal times? Ask about usual pattern of bowel elimination and urinating, including problems with mobility or transfer in toileting, continence, use of laxatives. Interpersonal relationships or resources. Social roles. How would you describe your role in the family? How would you say you get along with family, friends, and co-workers? Ask about support systems composed of family and significant others. To whom could you go for support with a problem at work, with your health, or a personal problem? Include contact with spouse, siblings, parents, children, friends, organizations, and workplace. Is time spent alone pleasurable and relaxing or isolating? Spiritual resources. Many people believe in a relationship between spirituality and health, and they may wish to have spiritual matters addresses in the traditional healthcare setting. Use of faith, influence, community, and address FICA questions to incorporate the person's spiritual values into the health history. Faith. Does religious faith or spirituality play an important part in your life? Do you consider yourself to be a religious or spiritual person? Influence. How does your religious faith or spirituality influence the way you think about your health or the way you care for yourself? Community. Are you a part of any religious or spiritual community or congregation? Address. Would you like me to address any religious or spiritual issues or concerns with you? Coping and stress management. Kinds of stresses in life, especially in the last year. Any change in lifestyle or any current stress? Methods tried to relieve stress, and if these have been helpful. Personal habits. Tobacco, alcohol, street drugs. Do you smoke cigarettes, pipe, use chewing tobacco? At what age did you start? How many packs do you smoke per day? How many years have you smoked? Record the number of packs smoked per day, ppd, and duration, e.g. 1 ppd times 5 years. Then ask, have you tried to quit, and how did it go? To introduce plans about smoking cessation. Alcohol. Healthcare professionals often fail to question about alcohol unless problems are obvious. However, alcohol interacts adversely with all medications, is a factor in many social problems such as assault, rapes, high-risk sexual behavior, and child abuse, contributes to half of all fatal traffic accidents. Be alert, then, to early signs of hazardous alcohol use. Ask whether the person drinks alcohol. If yes, ask specific questions about the amount and frequency of alcohol use. When was your last drink of alcohol? How much did you drink that time? Out of the last 30 days, about how many days would you say that you drank alcohol? Have you ever had a drinking problem? You may wish to use a screening questionnaire to identify excessive or uncontrolled drinking, such as Alcohol Use Disorder Identification Test, audit, or the cut down, annoyed, guilty, and eye-opener, cage test. Take 2. Cage test. Illicit or street drugs. Ask specifically about marijuana, cocaine, crack cocaine, amphetamines, and barbiturates. Indicate frequency of use and how has usage affected work or family. Environment hazards. Housing and neighborhood. Living alone. Knowledge of neighbors. Safety of area. Adequate heat and utilities. Access to transportation and involvement in community services. Note environmental health, including hazards in workplace, hazards at home, use of seat belt, geographic or occupational exposures, and travel or residence in other countries, including time spent abroad during military service. Intimate partner violence. Begin with open-ended questionnaires. How are things at home? And do you feel safe? If the person responds to feeling unsafe, follow up with closed-ended questions. Have you ever been emotionally or physically abused by your partner or someone important to you within the last year? Have you been hit, slapped, kicked, pushed or shoved, or otherwise physical hurt by your partner or ex-partner? If yes, by whom? Number of times. Does your partner ever force you into having sex? Are you afraid of your partner or ex-partner? Occupational health. Ask the person to describe his or her job. Ever worked with any health hazard, such as asbestos, inhalant, chemicals, repetitive motion? Wear any protective equipment? Any work programs in place that monitor exposure? Aware of any health problems now that may be related to work exposure? Note the timing of the reasons for seeking care and whether it may be related to work or home activities, job title, or exposure history. Take a careful smoking history, which may contribute to occupational hazards. Finally, ask the person what he or she likes or dislikes about the job. Summary. In this study session, you have learned that 1. Health assessment is important in nursing care. 2. Health assessment of a person is important in creating a database which is used to make a judgment or a diagnosis about the health status of the individual. 3. General overall health system includes present weight, gain or loss, period of time, by diet or other factors, fatigue, weakness or malaise, fever, chills, sweat or night sweats. End of study session 10. Thanks for listening.